Hello and welcome back to Science of Medicine. What I'd like to do in this segment is to help you make connections and apply what we've talked about in the nervous system to solving clinically important problems. I've done this before, and as always, if you have any comments or you like this, let me know, and you are always welcome to subscribe to the channel. So let's start off. 78-year-old person who smokes and has uncontrolled hypertension, both of those are risk factors for an ischemic stroke. Ischemia means that there's no blood flow, and this happens in the left frontal lobe cortex. Which symptom would be consistent with this stroke? Left arm weakness, right arm weakness, left leg numbness, right leg numbness, bradykinesia, which is slowness of movements, breathing problems, speech problems, or blindness. So think about that for a minute. You can pause it as you think. So hopefully you recognize that this would lead to a right arm weakness as being a consistent symptom. And you know that for several reasons. Number one, I've identified the location of the neurons that were affected in that stroke. In this case, the left frontal lobe cortex. And remember, the frontal lobe contains the motor cortex, all right? And the motor cortex is necessary for you to be able to have that arm movement. Secondly, remember that when you have a motor signal go from the cortex, it will cross at the pyramids, and it crosses there so that the affected side is on the opposite side. Try this one. A 72-year-old patient has an ischemic stroke in the right anterior cerebral artery. Which of the following symptoms is most consistent with this? Difficulty solving complex problems, such as the ones you're working right now. Difficulty breathing, slurred speech, left arm numbness, left face numbness, right arm numbness, right face numbness. So I'll give you a chance to think about that. You can pause the video while you're thinking about it, and then we'll move on. So I hope you recognize that this is A, difficulty solving complex problems, but the reasoning is just as important. So I told you a blood supply, the right anterior cerebral artery, and then I was asking you indirectly what areas are going to be affected if you have no blood flowing to that area. And then what effect would that have, or what neurons would those impact? So if you remember that the anterior cerebral artery, which is coming off of the internal carotid artery, is going to then deal with the executive functions, the frontal lobe executive functions. And that's what's important in solving this problem. Let's try another one. CIDP, chronic inflammatory demyelinating polyneuropathy, is a disorder of the peripheral nerves that causes weakness in the limbs. It results from demyelination of glial cells in the peripheral nervous system. And what that means is the glial cells detach from the nerve that it supports. Which of the following accurately explains what occurs? Do I have oligodendrocyte demyelination leading to an increase in the nerve conduction velocity, or oligodendrite demyelination leading to a decrease in the nerve conduction velocity? Do I have Schwann cell demyelination leading to a decrease in nerve conduction or an increase in nerve conduction? Or do I have a spinal cord reflex that stops due to demyelination of both the oligodendrocytes and the Schwann cells? So think about that. You can pause this video while you think about it. When you're ready, click it back on. So I hope that you recognize that the Schwann cells are the appropriate cells. They are the glial cells in the peripheral nervous system that help support the axons of those neurons. And so it is them demyelinating or coming off that is actually doing this. But also you recognize that this will affect the nerve conduction velocity. It will slow it down. And if you remember, we talked about myelination actually leading to this saltatory conduction. And that leads for a much, much faster conduction along, especially long axons, as you have to deal with just the electric field emanating at those nodes of Ranvier, as opposed to doing depolarization of each adjacent membrane. All right, let's try another one. A 68-year-old longtime smoker is diagnosed with metastatic lung cancer. One mass of the cancer has metastasized to the cerebellum. That means that a portion of those cancer cells have broken off and lodged, in this case, in the cerebellum. Which of the following signs might be observed? Right arm weakness, left arm weakness, paresthesias in both legs, balance problems, difficulty solving complex problems, or bradykinesia. So think about that, pause it. I hope that you recognize that this would be a balance problem. Remember that the cerebellum is responsible for the accuracy of motor activities. So if I have inaccuracy, that means I would have problems like ataxia or balance issues. Good job. All right, let's push a little bit further. A patient has a herniated disc around C7, C8 in the cervical spine region, causing impingement of the nerve exiting the spinal cord at that level. Which of the following symptoms is likely to result from this? Difficulty smiling, difficulty extending one or more of his fingers, difficulty flexing one or more of his toes, difficulty extending his knee, difficulty urinating. So pause it. When you're done, come back and let's see what you think. So I hope that you recognize that if a nerve is coming off at the C6, C7 region, that is going to be the nerve root dealing with the hand and upper extremity. So difficulty extending one or more of the fingers would be pertinent. If you remember that those nerve roots that come out have the disc that is between the vertebral bodies that can push back or compress, and that herniation can then lead to either pain or sensory symptoms or even motor problems if it's a very big herniation. I also hope that you recognize that for the myotome, as I said, the C6, C7 area is going to control a lot of the motor functions in the hand. All right, wonderful, wonderful job. Let's try another one. Normal pressure hydrocephalus is a condition in which excess cerebral spinal fluid builds up, leading to problems with walking, thinking, and urinating. The treatment for this disorder is to place a drain, or a tube basically, to allow CSF to drain into the abdominal cavity. This is called a shunt. Where should the other portion of the drain, the one that's not in the abdominal cavity, be placed in order to allow the CSF to drain into the abdominal cavity? The lateral ventricle, the frontal lobe, parietal lobe, occipital lobe, temporal lobe, or brainstem. So pause the video, think about it for a minute, and come back. Well, I hope that you recognize that the lateral ventricle is the only place that you could actually place this tube because I want to drain excess cerebral spinal fluid. And if you remember, the ventricles are what are housing much of that fluid, the lateral ventricles by far being the larger of the ventricles in the system. Great job. Let's try another one. Clonidine is a medication that binds the alpha receptor for norepinephrine, inhibiting its effect. Which of the following effects may a patient taking this medication experience? Dilation of the bronchi, dilation of the pupils, tachycardia, hyperglycemia, or diarrhea. So pause the video and then come back when you're ready. So this is a difficult question, And so I hope that you recognize that because clonidine is a medication that binds to something that normally would bind to norepinephrine, that this is something involving the sympathetic nervous system. So the other thing that's a little bit more complicated is that this is something that is inhibiting the effect of this. So let's talk about this a little bit more. If you remember for the sympathetic nervous system, that norepinephrine, if it were to bind, would actually then initiate a sympathetic response. And what would that be? Well, in the case of your bowels, the sympathetic nervous system, if norepinephrine were binding, would inhibit peristalsis. And so that would tend to slow things down. But if you inhibit this from doing its action, then you would actually cause additional peristalsis, and that would potentially give you diarrhea. Now, these questions that I've asked are meant to show you that you can apply your knowledge to actually solve real types of clinical questions. But it's important that you develop that skill if you're going to practice medicine or if you're actually going to be an engineer or a scientist, because it is with the use of that application that people find what you do useful. I hope this has helped. If you like it, please feel free to like this or send me a comment. If you wish, you're welcome to subscribe to the channel, and I'll see you next time in Science and Medicine.